Let's talk about APIXABAN for the treatment of venous thromboembolism associated with cancer. Definition: APIXABAN is a type of medicine known as anticoagulant or blood thinner. It makes your blood flow through your veins more easily. This means your blood will be less likely to make a dangerous blood clot. Venous thromboembolism in patients with cancer. Patients with active cancer have an increased risk of venous thromboembolism, which results in substantially morbidity, mortality, and healthcare expenditures. Corona score. What is the Corona score? Has been validated to identify patients with cancer at elevated risk for these complications and might help select those who could benefit from the thrombophilaxis. This range comes to the 0 to 6, with higher score indicating a higher risk of venous thromboembolism. In this picture, you can see what is venous thromboembolism, but the concept is clear. Applications in medicine. We conduct a randomized, placebo-controlled, double-blind clinical trial assessing the efficacy and safety of apixaban for thrombophilaxis in ambulatory patients with cancer who were at intermediate to high risk for venous thromboembolism and were initiated chemotherapy. The primary efficacy outcome was objectively documented venous thromboembolism over a follow-up period of 180 days. The main safety outcome was a major bleeding episode. Let's talk about results. Of the 574 patients who underwent randomization, 563 were included in the modified intention to treat analysis. Venous thromboembolism occurred in 4.2% in the apixaban group and 10.2% in the placebo group. In the modified intention to treat analysis, major bleeding occurred in 3.5% in the placebo group. During the treatment period, major bleeding occurred in 2.1% in the apixaban group and 1.1% in the placebo group. Applications in medicine. Let's talk about pros and cons to the treatment. Pros: The AVER trial showed that thrombophilaxis with apixaban resulted in a significantly lower rate of venous thromboembolic complications than placebo among ambulatory patients with cancer who were starting chemotherapy and Corona score of 2 or higher, including an increase in healthcare expenditure and a negative effects on quality of life. The cons: The treatment of venous thromboembolism with therapeutic anticoagulation is challenging in patients with cancer because this often involves daily injection of low molecular weight heparin, and it is associated with a higher risk of thrombotic recurrence and serious bleeding complications. Issue apply in Ecuador. In Ecuador, apixaban is used for therapeutics of heart failure in older adults. Other application is for stroke prevention in non-valvular atrial fibrillation in public healthcare sector or Ecuador. Conclusion: Apixaban therapy results in a significantly lower rate of venous thromboembolism than the placebo among intermediate to high risk ambulatory patients with cancer who were starting chemotherapy. Thanks.